Our next speaker is Dr. Leonard Rappaport. He is chief of the Division of Developmental Medicine at Children's Hospital, actually Boston Children's Hospital now, in Boston. And he is also the Mary Deming Scott Professor of Pediatrics at Harvard Medical School. The Developmental Medicine Center at Children's Hospital is one of the largest centers nationally evaluating and treating neurodevelopmental disorders. Dr. Rappaport has directed the fellowships in general pediatrics and developmental medicine and behavioral pediatrics for 30 years and has been involved in the training of well over 100 fellows. He is principal investigator on one of the 9 federally funded training programs in developmental and behavioral pediatrics. Dr. Rappaport is also a member of a multidisciplinary research grant in autism spectrum disorders and on the steering committee of the Autism Consortium. Please welcome Lenny Rappaport.
Well, it's a pleasure to be here today. And you, as perhaps I, were wondering why I'm speaking with this group of people. And actually, I figured it out that there's kind of a visionary kind of thing here that has nothing to do with me. Because when you start by the amazing statement that Kate made, the amazing science that you've heard about all day, you realize that it's really going to take a very large and effective village to deal and perhaps start to bring cures to children with autism spectrum disorders. And shame on us if we can't figure out a way to do that in the clinical setting. So that's what I'm going to be talking to you about today. Some of what I say will be a little bit of things that you've seen before, but we are now really where oncology was 20 to 30 years ago. Previously, we really had no way to get at the brain, as Dr. Hyman mentioned. When I started as an intern at Children's Hospital, it was pretty much a toss-up whether it was what would make a more horrible day, to tell a family that their child had autism or to tell a family that their child had leukemia. Now we cure 95% of children with leukemia, and we're just beginning to be able to think of treatments for autism spectrum disorders. And it's not because people have been lazy. It's because we really couldn't get at the organ system. And you've heard a tremendous amount about that today. Now with the Human Genome Project and genomics, knockout animal models with single gene disorders, progress in neuroscience, and new functional imaging techniques such as fMRI, ERP, MEG, and FNIRS, and Miraganka just talking to you about the potential, and I'd say it's still potential, but it's an exciting one, of stem cell to neuron technology for individualized medicine. All of a sudden, we have clinical programs across the United States that have been stressed to just keep up with the demand for diagnostic services with long waiting lists. We have to get ready and be ready to translate new knowledge into treatments in a high-quality way as soon as we're able to do so and be effective at doing that. And this is no small feat. And that's what I'd like to talk to you about today for a moment. We started this effort about 10 or 12 years ago at Children's Hospital, and it's continued to spread throughout the city of Boston. We started with clinicians who began discovery collaborations at Boston Children's Hospital with the scientists there, and then with MIT scientists, really facilitated by the founders of the Autism Consortium, who actually put me in the same room as Miraganka Soor, and as my chief, Gary Fleischer, said, "Can you imagine Lenny Rappaport being in the same room as Miraganka Soor?" And they all laughed. I sort of laughed. The AC facilitated collaborations across all Boston City hospitals back in the beginning to actually come up with a cross-Boston study of the yield of chromosomal microarrays, which have become the standard of care. I call that the Walsh study, since that was Chris's first idea. But it was done across the city of Boston, where we established that the state-of-the-art, which has become a policy statement of the American College of Medical Genetics, to do chromosomal microarrays in children with autism. Otherwise, people like Kate and my family with other disorders that have been identified would never know what the cause of their disorders are. The insurance companies say to us, why would you do this? They say, really, what does it matter? And the answer is that in American medicine, first of all, you're entitled to know the name of the dog that bit you. And secondly, how can we go further if we don't know who has what to move forward? That's the way science has moved forward in every disease. They didn't tell people not to look at cells to determine whether it was ALL or AML in children when they got sick. About 5 years ago, in a conversation with Chris, I think it was after one of these meetings, he started talking to me, Chris Walsh, he started talking to me about the work at Seaside and Mark Baer's work about the potential of doing clinical trials. And we at Children's started to do some small efforts in clinical trials with no infrastructure whatsoever, because none of the clinics had ever been set up to do a trial because there were no treatments really. And I would say we did not do a great job, because how could you do a great job with no infrastructure, not knowing sort of how to do it? So we've had some fantastic additions to what's here in the city of Boston over the past 10 to 15 years. The Nancy Laurie Marks Foundation funded the Laurie Center, which filled a massive gap in the city of Boston for the care of adults with autism spectrum disorders. There was no physician in the city of Boston who would take on the care of an adult with an autism spectrum disorder. I tried to collaborate with 2 institutions in the city to write a grant to get the Nancy Laurie Marks Foundation funds. And they said they did it all the time, but in the end, when we didn't get the funding, I tried to refer one patient, and they said, no, we can't take them. So a huge step forward with that. The Simons Foundation funded the Simons Center on the Social Brain, expanding the already groundbreaking work of the Brain and Cognitive Science Department at MIT that you've heard about here. The fact that that many scientists are working on autism spectrum disorder and related disorders should make all of us, parents and clinicians, feel as though there will be great hope. And finally, Boston Children's Hospital, MGH, BMC, BU Discoveries in Neuroscience, Genetics, and Cognitive Neuroscience have moved all of us forward in our understanding. Well, it suddenly became clear to us very quickly that we had better get ready, because all of a sudden we were starting to hear about clinical trials in this area from various people. It's sort of, I made the analogy, it's like a mouse in your house. Not the mice we're talking about here, and not the mouse on the second floor that Miragonka mentioned. But if you see one, there are really 100. And so we saw today a list of some of the trials in this area that we have to be ready to do. And in our own unit, we've made some massive steps in this direction. Bill Barbarisi came as my associate chief, and he began organizing the infrastructure for our developmental medicine center. Well, in parallel, Mustafa Sahin and Francis Jensen, who's now gone to University of Pennsylvania as the chair of their Department of Neurology, also did this in neurology, and we united them in a joint seminar series. Support for this work was purely through philanthropy. I mean, you have to understand that people who care for children with developmental disorders don't make much money. So my GI colleagues at Children's Hospital, they fund a lot of their research through their clinical work. That's not true in our case. In most cases, we're in the red, so we don't have much money to do anything. So this was all funded through philanthropy, which allowed us to build this infrastructure. And these parallel initiatives, we made sure were complementary. We weren't overlapping each other in any way. And most recently, we have formed, after the recruitment of Walter Kaufman, who you've heard from already today, a joint unit for translational neuroscience led by Mustafa Sahin and Walter Kaufman in order to do translational research at Children's Hospital. Now, the situation at Children's Boston is this. They're very motivated families. You heard from one of them today. You couldn't be more motivated than that. Very motivated clinicians. It is very hard for me to go in every day to see patients or call them on the phone, which I do every day, and not be able to offer them a real solution. Now, some kids do get much better with early diagnosis and early treatment. Last year, we saw 1,000 new patients with autism at Children's Hospital, up from 600 the year before. All are looking for a better understanding or cause and effective treatment. And right now, as was said by multiple of your speakers today, there is no medical treatment for the core symptoms of autism spectrum disorders. All effective treatments are behavioral, and I would argue that from my experience, that this is a fantastic therapy for about 20% of kids, and they make incredible progress. But for the other 80%, it is helpful, but not in any way curative, as was stated by our first speaker, Kate. We have multi-interdisciplinary specialty programs in Fragile X, the Down syndrome program. We have a Williams syndrome program, a Rett program, a TSC program, an Angelman program, all running multidisciplinary clinics. All of these syndromes have increased incidences of autism spectrum behaviors. But we have a very busy set of clinicians. And I'm speaking here not just on a local level, but on a national level. Believe it or not, there are only 600 developmental behavioral pediatricians, 1,400 child neurologists, and 5,000 child psychiatrists in the United States. And most of the child psychiatrists are not really very well trained in this area or very interested in little kids. There's good news and there's bad news. Pediatricians are, in fact, identifying children with autism spectrum disorder earlier. And as I said, about 20 to 30% of children with ASD have what is called, in quotations, recovery. And I see these kids every week, and they are so much better that it's like you're seeing a completely different child, but they remain with some of the common characteristics that are going to be impacting their life, but they're doing extremely well. The Early Start Denver method that was mentioned today in a statement about the EEG changes from one of our speakers, that method offers maybe even a better efficacy than ABA, but we have yet to really know the answer, but there's still behavioral therapies. We've now made a jump from what was 1% of the children who we saw having a cause that was associated with their disorder to 8%. Now that may seem, it's sort of like the half full, half empty. It's not anywhere near a half, but 92% of kids, we still don't have a diagnosis, but 7% more than what we had before. But we still don't know the mechanisms, although they're proposed here. All centers that are providing services for kids with autism are fiscally challenged. And in this transition in healthcare, one would think these groups would benefit in the transition, but right now it's not looking that way. I hear very dire news from various programs around the United States, a lot of worry about their ability to keep up with the demand for what they do, let alone what they really want to do. Fortunately, at Children's, the Developmental Medicine Center, which is a separate division, and neurology are in the black, meaning that, we're not failing. We're not having to fall on the arms of the hospital, but where there's, as Jim Mandel, who's the president of our hospital, would say, Lenny, there's not much margin in your patients. So we all need to run a very lean clinical machine. So the costs of infrastructure need to be funded creatively. And it's this creativity, that's only with this creativity are we going to be able to be ready to take what comes from the labs and the promise that you're hearing here and make it into a reality and not get held up on the way. So we've been working hard at this, and I can honestly say that this is total thanks, in our case in the Developmental Medicine Center, to our philanthropic board who's supported these efforts. We have a number of pharma trials. Now, some of you, I used to think before I did pharma trials that in reality they would make money, but in reality they don't make money. They barely break even. So we have a number of trials. One in adult patients with Fragile X by Novartis, another in Seaside. So almost all the trials that you heard about today are going on at Children's Hospital in the Departments of Medicine and Department of Psychiatry, including investigator-initiated trials in Rett syndrome and in TSC. We have a number of other trials that you see here, the Dennis Wall diagnostic effort that you saw listed and was presented last year here, and SynapDX potential diagnostic test in expression RNA, and a number of biomarkers and other treatment trials in process. We've also been working on early diagnostics in Chuck Nelson's lab, looking at brain function as a potential diagnostic key. Wouldn't it be great if we could diagnose autism by eye gaze and other things at the age of 6 months and perhaps intervene long before we're able to actually see the behavioral side effects of these disorders? But there are challenges. We need to improve our infrastructure prior to increased trials. We're already saying no. I saw Paul Wong here today, and we've already had to say no to one trial from Seaside because we just didn't have the infrastructure to take care of it. The trials are increasing, but managing the peaks and valleys is very difficult fiscally. You don't know what's around the corner, so things can go up and down, and you can be stressed. Recruitment needs further enhancement. We've, because of this, had a cross-Boston recruitment database that Chuck Nelson started when he came from Minnesota, and we've expanded to our whole division and will expand to the whole conglomeration of centers at Children's. We use the AC website for research recruitment, and also there's this psychopharm exclusion issue that you may not be aware of. Many of the families who are the most interested in being part of things are already on risperidone and Abilify because they have so many problems, which puts them sort of out of the reach of a drug trial. So in reality, we're working with this next group of people who are less interested in risk, and I don't blame them because they're children, and I'm a pediatrician. Children and scientists need to continue to improve their communication. We still have a major gap between our labs and our clinics. We can talk to each other, but we use different languages. And we need to continue cross-institutional and intra-institutional recruitment efforts. I think we're still, even with the help of the Autism Consortium, which has been incredible, still working somewhat separately, more so than we would want to be. So here are some potential solutions. I think we need to continue to enhance the Autism Consortium collaborations across the Boston area. The impact on clinical care of children and what their families can access through the AC website and materials has been incredible. We need to formalize, and I really mean formalize, our ties with the MIT Simon Center for the Social Brain. I mean the clinical centers, not just Children's Hospital, hopefully, because there has to be a way that we can all do this together. We have to expand what we're doing. We've just started a joint autism center at Children's Hospital, which I almost thought was not possible, including neurology, developmental medicine, genetics, and communication enhancement, as well as psychiatry. And we hope to expand that to a neurodevelopmental center, because just as was mentioned by Miraganka, I hope this is like the like radar. I would make the analogy to the space program, and we're sure hoping for other neurodevelopmental disorders that will get something more valuable than Tang out of this. those of you who know what TANG is. Finally, we've started a neurodevelopmental, a neuroscience translational research program from bench to clinic under Mustafa Sahin, Walter Kaufman, Bill Barbarisi, Noel Huntington, and Lisa Albers to facilitate this across all departments at Children's Hospital. And I would just present an idea as I close, which is that wouldn't it be great to unite this effort into one effort that would span the city of Boston, include all the institutions in a way that would uniquely facilitate this village of care for children with autism and developmental disorders. As was stated this morning by Dr. Fischbach, this is the hub of where knowledge is in this area. We need to work well together and keep our eye on the ball, which is helping families to change the lives of their children and their children's children. Thank you very much.